All right, we got some breaking news today that the Social Security Administration is going to expedite the Social Security Fairness Act to get rid of the WEP and the GPO offsets. So, guess the commissioner started to send out some of this stuff through email to people that are logged into mysocialsecurity.gov or whatever the case may be. Not sure how they're deciding when to do this and how to do it and what method. Everything is everything is crazy. The new acting commissioner of the Social Security Administration is a Doge guy. I guess he was being investigated for doing things he shouldn't have been doing, and he was looking for another job, and he was made the commissioner by the Doge team. So it is what it is, I guess. But it just announced today that the Social Security announces expedited retroactive payments and higher benefits for millions. Okay, I want to make sure we're talking about the right thing here. A lot of people might think that this is the so-called Doge dividend, the Department of Government Efficiency dividend, where they're talking about however many trillions of dollars we save, we'll give 20% to back to the American people. We use 20% to pay down the debt, and we know where the other 60% is going. But this is not that. They said the Doge dividend stimulus, whatever you call it, that won't happen until maybe next year or the year after. Once they supposedly find the money. They found a little bit. They still haven't found all those billions of dollars supposedly went to the people over 150 years old, because guess what? That was an incorrect story. Even the new commissioner of the Social Security Administration did a press release where he said, okay, that's not, he tried to play a fine little line and tried not to disagree with his bosses, but he essentially said, hey, it's not accurate. Okay, so this is not that. This is one that was signed by President Biden just before he left office. It was supported by pretty much Republicans, Democrats, left, right, independents, the whole nine yards. It was supported. It was a bipartisan support, which is very unusual to do in Washington. Bipartisan support on anything is always very, very strange. So something was kind of fishy on there. But anyway, and it was supported by President Trump. People say, "Hey, how come you have President Trump's face on the thumbnail?" It was by President Biden. Well, the reason President Biden signed it because he knew President Trump would sign it, and therefore he wanted to pretend like he was, supporting Social Security, which this does not support Social Security. It actually depletes the Social Security Trust Fund sooner. This basically the getting rid of the windfall elimination provision and then the government pension offset essentially gives a higher percentage of benefits to 3%, about 3 million people that are receiving benefits. So you've got about 3 million people. And these are people that worked for states, local, city, and many decades ago for the federal government, and they didn't pay into Social Security with those primary jobs. They paid into Social Security maybe doing part-time work or before they worked for those non-covered entities, or as they're called, or after, whatever the case may be. So they are insured for Social Security, definitely insured for Social Security. But the percentage, and people that watch my channel know that your benefit amount is based on how much you actually paid into Social Security. And these windfall elimination provisions, the 3%, 3 million people are going to get a higher percentage than other people that paid into that has similar earnings. So that's why I always disagree with it, but I lost that battle and the politicians decided to play politics and pass it. So there it is. And so let's talk about it now. So I just wanted to pass it on for all the people that the other 97% are saying, hey, am I getting this money? You're going to get a lot of news about this money coming in and stuff. No, unfortunately, it's not for you, the 97%. It's only for retired government workers, state, local, federal workers. And they're just going to get a higher percentage than the rest of us. And that's the situation there. So, okay, now I want to talk to those 3%, the 3.2 million people that are going to be receiving this. They said it's going to be expedited, and they are doing it, based on a computer. And it was always going to be like that. I'm not sure how the agency's original estimate of taking a year or more now will only apply to complex cases that cannot be processed by automation. It was always going to be like that. As soon as the lawyers came in and decided how this was going to be done, because when Congress passed it, the HR 82 only had two sentences: Social Security, do this. And there's many permutations. So the lawyers had to take a look at it. The old Chevron ruling that the Supreme Court overruled makes it more difficult to look at stuff like this, and they have to spend a lot more time. But then they needed the computer programmers to go in there and find all of the people and recalculate their benefits, those that are currently receiving WEP and GPO offsets. So it was always going to be like that. And it's still going to take a long time to do the manual ones. Okay, so let's break these up into buckets. The people that, and I'm also going to do a live Q&A here in a little bit. So if you've got any questions, it looks like we've already got a lot of questions here. I'm going to try to go through as many questions as possible on this. So make sure you type your questions. I usually do a question and I do a topic of the day, and I talk about the stuff and I answer questions for about an hour. I already did that this morning. So we're only going to do about 30 or 40 minutes of questions. But if you're already receiving benefits and your benefit has been reduced because of the windfall elimination or the GPO, you pretty much don't have to do anything. As I mentioned before a couple of months ago, once they have the lawyers figure it out in exactly policy, they write the policy. Then once the policy is written, then they get the computer programmers to go in there and reprogram the system to readjust those benefits and take out the windfall elimination provision and take out the GPO offset. So that was always on the schedule. You just have to make sure, if you're in that bucket, you need to make sure that your address and your direct deposit and your phone number and everything is updated, just in case something's going on. All right. So, but the most important part that's not going to be automatic is those people. And this is what I mentioned a couple of months ago when this first came out. If you have anybody in those three, again, we're talking about you 3.2 million. If you have other people that are entitled to benefits on your record and they never filed because of the WEP and particularly because of the GPO. So here's the situation. You have a spouse or an ex-spouse, or you are a spouse or an ex-spouse yourself, and you or them, they were going to file for benefits on a record. But you were told by the Social Security Administration at that time, let's say GPO, your non-covered pension, 2/3 of that will offset what you're receiving from your spouse. And you're receiving $1,000, $2,000, $3,000, $4,000 from your non-covered pension as a teacher, firefighter, police officer, whatever the case may be. And you're saying, okay, I'm not going to receive anything, so I'm not going to file. Those are the people that it's going to take a while to reach out to them. So that's why I do these videos every now and then. You reach out to those people. They might be struggling, might have a hard time, but they're entitled to benefits now and that the law has changed. So reach out to those people. Your current spouse, your previous spouse, your aunt, uncle, grandma. Hey, weren't you married to someone at one time that was a cop in Texas or a teacher in Dallas or a teacher or a firefighter in Los Angeles or Chicago, wherever these non-covered pensions happen? Aren't you entitled to benefits on that person's record? And they might say something, yeah, I filed a long time ago. And they said, there's just not enough money there. The calculations weren't correct. You need to reach out to those people and tell them they need to contact the Social Security Administration. Again, call the 800 number and say, hey, I was married to someone at one time, 10 years or longer, or I was married to someone and I was married to that person for at least 9 months. And because that's what you need in order to get the survivor benefits, at least 9 months if you were married to that person when they passed away. Tell those people to reach out to the Social Security Administration and get in line for the manual computations. Well, if you're filing a brand new claim like that, it won't be manual because you won't have to wait because the system sounds like they finished updating it. So if those people reach out to Social Security and say, hey, now I'm not going to be a full offset, what I receive from that pension doesn't affect what I can receive from that person, they just file a claim like regular and it goes through. It'll go through the modernized claim system, as the Social Security computer system is called, even though it was based on, as we know now, it's based on Fortran and COBOL from the 1970s. So not much modernization there. All right. So that is the situation again. So update your address, update your direct deposit, reach out to all those people you were married to. And the reason this was passed, or this expedited thing, is because people reached out. I put up the phone number on a continuing basis. Hey, if you want this to be done quicker, if you want disability claims to be approved quicker, reach out to your representative, your senator, and your House representative. Unfortunately, for the other 97% of people that are not going to be receiving these higher a higher percentage of benefits, their check will not be increased by the higher calculation. Those people, unfortunately, will be negatively affected by it because the Social Security Administration, which is already at a 50-year low of staffing, now they're being pushed to do these things quicker, and all the other workloads are going to be put to the side. So I'm sure this is usually when a thing like this happens, some type of initiative like this happens, then X amount of employees at every office are tasked with that, and they can't work on other things. So all the other people, the other 97% filing for retirement benefits or Medicare or survivor benefits or disability or benefits or whatever, unfortunately, you're going to have to wait longer because there's people in the office that are now part of this initiative. And as I mentioned, this is also going to be depleting the trust fund sooner. So I always put up here the calculation. Let me put up the numbers here. No, that's not this one. Okay, so as of the last few months, the Social Security trustees haven't come out with the new numbers yet, but the trust fund is going to be running out about 2034. And this was before the Social Security Fairness Act passed. The new numbers aren't out yet, but it's probably going to be sooner. So the trust fund will run out probably in 2033 now. It's probably also going to be more of a cut in 2033, probably 22-23%. The numbers aren't final, but at least it's this amount. And then, the no tax on tips and no tax on overtime and no taxes on Social Security benefits, that's also going to put more strain on the system. And so we're going to get cuts sooner, probably about 2030 or 2033 or 2031, and there are going to be more. And so all those people that reached out there to politicians, the 3% that reached out there to politician and got put, kind of ahead of the line in this respect, the other 97% needs to reach out to their politicians and say, hey, we want to make sure our benefits don't get cut. We want to make sure we get what we paid into Social Security all of those years. So, okay, let's answer some specific questions here. I'm going to try to focus on ones that specifically ask about the WEP and the GPO. I've got a lot of other questions here, but I just want to focus on that since we don't have that much time. Can you explain spouse benefits, please? My SSI, well, it's not SSI. SSI has nothing to do with WEP. That's SSI is Supplemental Security Income. That's the welfare-based program, Social Security administrators. You mean Social Security. Okay, so I'm going to answer it by you meaning Social Security. Your Social Security was reduced by WEP. If still married and my wife gets spouse benefits on mine, will my monthly Social Security be reduced? Wife on SSDI, can I get spouse benefits? Okay, so here's how it's supposed to work. If your spouse is currently receiving benefits on your record, auxiliary spouse, when they do the calculations, and it looks as though they said it's going to happen in April. So do not contact Social Security before you get your check in April. Wait till you get your check in April. And then in April, it's going to be crazy. Good luck trying to get into Social Security in April when everybody gets their checks and they say, well, I don't think I got as much as I thought I was going to get, or I didn't get it, and whatever the case may be. But you wait until April. And how it should happen is because your benefit will be unwept, your primary insurance amount will be increased. And because your wife is on your record, on the MBR, the actual record, because your PIA, your primary insurance amount will be increased, hers will automatically be increased as well. That happens every single year across the board. If, for instance, if you are working and you pay into Social Security, and last year is one of your high 35 years of earnings, then Social Security does the calculation once they receive all the, the W-2s and the 1099 or something from the IRS, whatever the case may be, and they see if that's one of your high 35 years. If it's one of your high 35 years, they throw out the low one, stick in the new one, recalculate, increase your benefit amount. And because your spouse is on the same record, the master beneficiary record, then they are automatically increased. So the exact same thing will happen as long as the programmers, do their part right, which, I mean, to unwep it shouldn't be that big of a deal in terms of, I'm not a computer guy, but I know the master beneficiary record, and if one increases, the other one automatically does. So, all right, why do people have to be married 10 years? So that's the essentially the law they passed. To be married, you have to be married. But one of the things, as I always say, regular viewers to my channel know there's exceptions, the exceptions, the exceptions, and the exceptions on this one is doesn't necessarily have to be consecutive if you remarry the same person. I looked into this, and 5% remarry the same person. If you are married to someone for 5 years, and you divorce that person, and you remarry that same person by the end of the calendar year, by December 31st of the next year, and then you're married to that person for another 5 years, then Social Security can add those 2 times together, 5 years and 5 years, to make 10 years. So it's one of the exceptions. What I know, there's a lot of people out there that are not getting the benefits they're entitled to because, they think it wasn't 10 years. All right, Lee, I am a prior CSRS 10 years private. Wife draws from my quarters because she is short on quarters by 2 years. She worked TRS, Texas Retirement System, 10 years. However, 2 years, no quarters due to TRS WEP. Will she benefit? So she is not insured on her own record because she'd never paid into it, really. She worked for the Texas Retirement. So yes, if she is on your record and the government pension offset no longer applies, then 2/3 of her pension will not affect her benefits. And as soon as they update your primary insurance amount, the benefit at full retirement age, then they will, as I mentioned, the other part will be automatic. All right, let's see here. What the hell is happening? Exactly. My sentiments exactly. Which year administration was the FICA cap removal first brought forward as a solution? Oh, it's been around for a long time, but the powers that be just don't, Oh, Stacy, thank you very much. Doc, I just needed to know if I'm safe using my SSDI for a mortgage. Just safe. Yeah, yep. We used to have people come down to the Social Security Administration all the time, says, hey, I need a benefit verification letter to show to the mortgage company that I have income. So, yep, no problem whatsoever. SSDI, Social Security Disability Insurance. And thank you for this support. I appreciate it, Stacy. All Democrats voted no. That's incorrect. It was by the Social Security Fairness Act was passed by bipartisan support. So let's see. Susan, CSRS. So CSRS, federal employees. Most of this doesn't apply to federal employees because starting in the 1980s, the federal workers changed from the old CSRS, the Civil Service Retirement System, which has been around forever, back to the 1800s, the Pendleton Act, after Garfield got assassinated. But anyway, in the 1980s, they got rid of that system and they started the FERS system, Federal Employment Retirement System. And since the 1980s, federal employees, and including politicians, you hear that internet myth about politicians don't pay into Social Security. If they, have been politicians since prior to the early 1980s, possibly, Some of them have switched. They could have voluntarily switched, but federal employees or new federal employees are not part of this whole system. The, the 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 leftovers. Sorry, I call you leftovers, but leftovers from the old system, like Susan here. It looks like she possibly got that offset. Okay, so that's CSRS annuitant who earned more pension than my spouse who receives regular Social Security. Told by Social Security in January that I can't earn Social Security spousal benefits because I earn too much. Doesn't GPO repeal cure the offset? Yes, it does. Yep. So yeah, when you called up Social Security at that particular time, I guess it hasn't been signed. Well, it had been signed by the president, but Social Security employees weren't really saying anything, and because wasn't taking effect or something, or the Social Security employee didn't keep up. Anyway, but yeah, if you're talking about because you earn too much, okay, that's kind of a what do you mean by earn too much? If you are under your full retirement age and you're earning over, the annual amount 23,400, are you talking about that, or you because that's earnings? You mean I think you mean your pension is too much, and therefore it's a government pension offset. If you're talking about earnings, work earnings, then you're talking about something else. But if you're talking about pension, then the GPO repeal will cure that offset. Let's see here. What other kind of questions? Hooray for the Fairness Act. Yeah, that's and people are going to complain about, Ed, why are you against it? It's just I paid into Social Security. I agree. You should get an equal percentage as other people. So if you have a teacher, firefighter, police officer in Texas who earned X amount, and then you have every other firefighter, the other 97% of firefighters, police, and teachers that earned exactly the same amount, this group is going to receive a higher percentage of what they paid into Social Security. The rest of these 97%, let's say just for, maybe they 50% or 55%. Okay. I'll say 55% just to use a number. This group gets 55% of what they paid into Social Security. This group is going to get 60%, 65%, 70%. And that was the windfall that the windfall elimination provision was supposed to stop, which everybody knows the way they did the calculations for the windfall elimination provision and the government pension offset was, incorrect for a lot of people. But there's other ways rather than throw the baby out with the bathwater. So if these people are receiving 55%, if 97% of people receive 55%, and they worked exactly the same amount as these people should receive 55%, but they're not. They're going to receive 60, 65, 70. And that's the unfair part of the Unfairness Act. They should have, yes, got rid of the WEP. I agree. They should got rid of the WEP. They should have got rid of the GPO, but they should replaced it. They should have replaced it with something that makes it actually, what's a good word? Fair. But Biden and Trump and all the politicians tried to play politics and pretend like they're supporting Social Security, which they aren't. It was just 100% politics. All right. Oh, I've got just denied SSI. What's next? 65, female. I have heart disease and headaches, divorce, need help. If you were denied, SSI is the welfare-based program. If you were denied SSI because for okay, wait a second. For SSI is the welfare-based program. You can get it based on disability or being aged, 65 and older. So you don't have to be disabled to get SSI at 65. You just need to have low income and low resources. So if you're 65 years old and you were denied SSI, then that means you just have too many resources or you have other income coming in and you're not entitled to the welfare-based benefit. Don't lie, there is no trust fund. That's exactly why that sentiment right there is exactly why this is going to happen. Because there is a trust fund. It's about $2.6 trillion. If you don't think there's a trust fund, then take about 10% of your Social Security check and please donate it to charity, animal shelter, or women's shelter, or whatever the case may be, because about this year, probably 8, 9, 10% of your Social Security benefit came from the trust fund. So, and this is a lie that politicians have been telling us for a while, so they can kick the can down the road, distract us, and that way they can privatize Social Security, give it over to the Wall Street, their Wall Street buddies. And because we continue to fall for these, so retired postal worker, I'm concerned that we won't benefit from this benefits. It really depends on when you started becoming a postal worker. If you're under the old civil service, you just might, get an extra percentage. If you're not, then no, you will not. Learned a lot from you. I've told my sister to watch your channel. All right, good. That's what we like to hear. That's people sharing and subscribing and liking and stuff like that, so people can get all the information. I know I made a lot of the 3.2 million people that are not happy with me right now because I disagree with them getting a higher percentage than everybody else. But hey, I'm not a politician, so I'm not trying to use you for other. I applied for Social Security during the sign up on December 7th. Do I have any chance to get my first check in April? I have not heard anything about being accepted. Applied for Social Security during the first sign up in December 7th. I'm not sure what December 7th. I know December 7th is the final day to, pick a Medicare supplement plan, or excuse me, Medicare supplement too, Medicare Advantage, Part D, Medicare supplement, Medicare Advantage. December 7th, that was that last day. And if you need help with Medicare, you can reach out to my partners there who sponsor all this. But if you applied for anything, doesn't matter what it is, retirement benefits, survivor benefits, spouse benefits, and you're still waiting, then that's an issue that you need to contact your politicians and say, hey, what's going on? Let me throw up the number there real quick. So reach out to your politicians and say, hey, we need to save Social Security. We need to improve customer service. And those are the questions you ask them, and those are the phone numbers you call. So, that's how the people that are subject to the Social Security Fairness Act, that's how they got this thing expedited, is, they harass their politicians. So we need to do the same. I'm receiving a federal pension, but don't qualify for Social Security on my record. I applied in January as a divorced spouse. He's deceased. Do you think this new law will take my application longer? Well, this new law will give you your benefits, period. It sounds like if you're not insured on your own benefits and you're receiving a non-covered pension, then before this, you weren't entitled to those benefits at all. But if you filed a new claim in January, they're probably sitting on those until the computer programmers go in there and take out the WEP and the GPO part of the system out of the. So yours shouldn't take longer. Yours should take as regular. And again, it says in the press release, don't call us. We won't call you. Don't contact us about this until you get your check in April, and hopefully everything will be good at that time. But remember, please, let's reach out to these people that didn't file for those benefits and are not in the queue to get their benefits increased. That's the law. And let's make sure the people that are entitled to it get it. 3% giving more would be great. Will giving more for millions protect the future at SSI? I've seen estimates of probably 200 billion or so. It's going to put a big chunk out of. All right. Am I understanding this correctly? Even if they did not pay into Social Security, they will receive money? No, you're not understanding this correctly. These people, the 3.2 million, these people, that's a bad way to put it. Anyway, the 3.2 million people who fall under this, they did pay into Social Security. So when they were young, they worked, 10 or 20 years working at some place and paying into Social Security and everything. And then later they got hired by the government or, became a teacher, police officer, firefighter, janitor, and whatever the case, working for the government, state, local, federal government. And they did not pay into Social Security at that time, but they did pay into Social Security. If not, then they're not going to get anything because they didn't pay into it. So unless they are spouses. But all spouses are that type of situation. So if you're a spouse of someone and you never worked because you stayed home and, took care of the kids or whatever the case may be, you are entitled to benefits on your spouse's record, even though you never paid into Social Security. So only 3% will get increased in their Social Security, not everyone. People who are getting pension 3,000 or more, their Social Security income will be adjusted. That is correct. I really have enjoyed listening to you because I've learned a lot of things I didn't know before. Awesome, Margaret. Hey, that's my mother's name, by the way, Margaret. So always good for Margaret. But yes, and most important thing, Margaret, is to go out there and share that information. People around you. Oh, it looks like you already did. You've got a second question here. I tried to get my sister to want you, but I've never been able to give you your total name, so maybe I can give it to her now. Yeah, yep. Just tell her to Google me there. Let's see. Oh, got a negative question here. Constructive criticism. Wrong way to look at it, Ed. Our money has propped up Social Security for many years. We weren't getting our full benefit. Yes, you were getting your full benefit. You were just not getting the extra. And again, I've done this several times. I've talked about it. The bin points, 90%, 32%, 15%, and Social Security since 1935 has paid higher wage earners a lower percentage than those. And so I've talked about this. Yeah. So you've always been getting your full benefits. Well, I mean, not 100% because it really depends on the situation. But to throw the baby out with the bathwater, and now you're getting extra percentage than everybody else, I think the 97% would disagree that you are getting a full benefit, that you're getting that you're getting extra. I'm 59 disabled. My extra is retiring. Can I draw off him for anything now? Yeah, when your ex files for benefits, not sure the numbers and everything, and well, you're 59, so you wouldn't be able to receive anything because he's your ex, and it sounds like he's still alive and kicking. So you won't be able to receive anything until you turn 62 years old. So at that time, definitely check to see if you are able to get benefits on his record. Thank you for the clarification. I currently receive Social Security for over 60 years of work paying into FICA, military, and law enforcement. Perfect. Let's see. I'm picking these things at random here. I'm not looking for a handout. I worked and made my 40 quarters. That's all I want, just based on my 40 quarters. Is that not the way it's figured? Nope, that is not the way it's figured. It's based on your high 35 years of earnings and all of those years you paid into non-covered employment. The Social Security computer system does not look at those earnings. So you could have made $1 million. Well, it doesn't matter because there's a cap, but you could have been making $100,000 for 35 years and not paying to the system. And Social Security is now going to treat you as a poor person that's been eating out of the trash can and receiving food stamps for decades. And because of that, they're going to give you, a higher percentage. So if you look at the actual reasoning, go onto the Social Security website and ask and say, why was the what was the windfall that the provision was to eliminate? It was to eliminate Social Security system from thinking you were a low-income poor person that was living on welfare most of your life. So there's that. Please like this live stream. Only 400. Yes, please like it and subscribe and all that kind of good stuff. Tina, so if I'm a widow and on SSDI, do I try to apply to survivor benefits again? They told me I made too much with Social Security disability. Okay. So you're a widow, and this is a good question, Tina. If you are receiving disability benefits, a lot of people miss this. If you're receiving disability benefits and you turn 60, you should definitely check to see if you're entitled to any survivor benefits. Because if you are, you can receive those survivor benefits on top of your disability. One offsets the other, but you can receive those extra money if there's extra money there on top of your disability. And your disability won't stop. You will receive disability and survivor benefits. Same thing at 62, spouse benefits, divorce spouse benefits, disability, and those spouse benefits. A lot of people don't go out there and get that extra money because they say, well, I'll get extra money, but I'll lose my disability and therefore my Medicare. That's not correct. Your disability will continue and your Medicare will continue. And then when you turn 65, check to see if you're in, if a Medicare supplement plan is best for you, because you cannot be denied when you turn 65, like most people are that receive Medicare based on disability under 65. Once you hit 65, they can't deny you and ask you any health questions or, any of that. So, or charge you extra. Robin, I'm thinking of retiring at 62 because of arthritis disability. I have two exes, one for 13 years and the other for 10. Will they look up both of these to see how to get me the highest possible amount? Yes. So you'll have to file for benefits on your own record. And then the Social Security employee will ask you those questions. Were you ever married to anybody for 10 years or longer, or married to anybody that, they're ended in death? And then if you tell them, yes, these two people here, you don't need to know the Social Security number. So if you don't know the Social Security number, no problem. You just tell them the person's name, the date of birth as well as you know it, and where they were born, city and state, and they'll be able to find the Social Security number. I've never not been able to find a Social Security number. Is that a double negative? I contradict myself. But anyway, I've always been able to find a Social Security number with very limited information when I worked at Social Security. And then they'll determine which one, if either of them, to get benefits. But you also said you're retiring because of disability. Remember, if your disability, your arthritis, is preventing you from working, you might want to consider filing for disability as well. Even though it's going to take 6 to 9 months, if you're lucky, to get a decision, you can file for retirement benefits and disability at the same time. Why would you do that? Because disability decision takes 6 to 9 months if you're lucky, and a lot of people can't live, for 6 or 9 months waiting for that. So they file for early retirement and start getting those checks in while they're waiting for their disability to be approved. So. Joey, I'm turning 62 next year. My husband is on SSDI. Can I claim under his while I am working? You have to file for benefits on your own record, and you have to limit your income to $23,400. Well, next year it's going to go up a little bit. So let's see. They said we should be getting the Fairness Act at the end of March. They said, well, March, and then the March check comes in April. So they essentially said, don't call us until you get your check in April. And this is a good point. Because this is happening in April, and Social Security is going to be just crazy in April, of all these 3 million people calling up and saying, well, I don't think I'm getting it, how much I should get, and whatever the case may be. So if you know anybody in your family, relatives, friends, neighbors that had any children in 2024, make sure though they have those children's Social Security numbers, because they're going to need it for taxes. What happens every year at the Social Security Administration is end of March and first couple of weeks in April, people go to file their taxes and realize they don't have the child's Social Security number that just was born last year. And Social Security gets inundated around that time. And with this going on, they're not going to be able to get their Social Security cards in time. Possibly, it's going to take them. It's going to be a nightmare. So reach out to those people that had a baby last year and say, "Hey, by the way, congratulations on the baby. It's so cute. Did you get a Social Security number? Okay, you're good. Okay, but if not, tell them to apply immediately, if not sooner." Cruz, I'm a retired Texas teacher, 76, and receiving Social Security benefits. I think that I was wept and pension offset. When my wife turned 70, we went in and we were told she wasn't getting anything. Can she file now? Yes, Cruz. Yes, file now. That's exactly what we're looking at. See, we found one. All of the people that pay, all the people that pushed subscribe and like and all that, whatever the stuff it is. That's how Cruz got to this, and now he knows that. Please, it's still, I think the phones are probably closed by about now, but call tomorrow. Have her call tomorrow, the Social Security Administration, 1-800-772-1213, and get in the line. You're probably not going to get an appointment for a month or two, but you need to do it immediately. She needs to do it immediately and say that she wants to file a spouse claim on your record. So they will ask her Social Security number and then your Social Security number, and they will set up an appointment probably next week next month or the month after. But at least she'll be protected. And then when she gets it, the government pension offset won't be relevant anymore. So make sure you come back next month or 2 months or 3 months from now when you get your benefits and say, hey, she got the extra benefits because of all the people that pressed like and subscribe and all that kind of good stuff. So you guys are awesome like that. I'm just some guy sitting here babbling on for an hour every day. Y'all are the people that get the information out there. So thank you. That's the technical word, babbling. Is there a caregiver program that compensates a parent that is also a legal guardian of an adult child with special needs? They denied people who were parents and legal guardians for participating. It really depends, not for the Social Security Administration. There is, for Social Security, there is called the Auxiliary Child in Care, Child in Care, Survivor Auxiliary Child in Care benefit. So if you have a disabled child, or if you have a child that's under 16, and you're essentially staying home to take care of that child, you can get child in care benefits from the other spouse, the other parent that is receiving retirement or disability benefits. So it's under 16, or if the child became disabled before the age of 22, then yes, that's the program Social Security has. But you are probably talking about like things in there. I know there's in California, I think Colorado, Florida. Those are state programs called IHISS, something like that they pay people to take care of elderly or the disabled. So let's see. If your benefits were WEP and you were eligible for GPO, will you receive both increases? Yes. Yep. The WEP is no longer going to be applied, and the GPO is going to be wiped out. So yes. So can you please tell me how long does Social Security take to report our income to the IRS? It's the reverse. Once you file your taxes and your employers submit the W-2s and you do your 1099s and 1040s or whatever, you notify the IRS, your employers notify the IRS, and the IRS notifies Social Security. So it's the other way around. You need a cup of coffee, Dr. Ed. Yes, Megan, you are awesome. Thank you very much. That's a coffee IV for a few days there. You guys are awesome. Yes, I have a terminal illness and I am 55, but trying to find where work is hard with my disabilities. So that's exactly what disability is out there. I'm going to be doing an hour-long disability program this week because as part of the congressional budget, this is one thing they're really going to go after: disability, SSI, supplemental security income, and Medicaid, food stamps, and stuff like that. And before I worked for Social Security, I worked for the Department of Social Services doing Medicaid and food stamps and all that. But in terms of disability, I'm going to do like an hour show on those people on disability, how to protect yourself from anything incoming, how to document yourself, how to address CDRs, a continuing disability review. So make sure you subscribe. I'm working on that now, and I'll do it in the next couple of days, 3 days. So, all right. I said I was only going to do 30 minutes, but here I am continuing on. My mom pays, and I was told to file for her benefits, and they said, buy me work, and I couldn't get them. I don't understand. My mom pays. Yeah, I'm not sure what my mom pays, and I was told to file for her benefits, and they said, yeah, I'm not sure what you're asking there. Sorry about that. Turning 65 in May and signed up for Medicare Part A, B, D, G, along with the vision and dental. I was told that I should wait to collect Social Security on my husband's account until I'm 70 to get the extra 24%. True? No. But good on. So you did. You know, hopefully you don't have health insurance from work. Yours or your spouse's. If you have health insurance from work and you're happy with, and that employer is not making you sign up for Part B, and that work has to have 20 more employees. If none of that applies to you, then number one, you've done the right thing. You got your A, you got your B. I always recommend the Medicare supplements, the Plan G or the Plan N, if it's in your budget. So you're doing great there. You got the Part D. A lot of people miss that. Is when they get 65, they sign up for a Medicare supplement plan, and then the agent or the broker says, okay, we got to sign you up for a Part D plan. And you're like, no, I don't take drugs. I don't want it. And then the agent or the broker doesn't make a real commission on that. So they say, okay, fine, be that way. See ya. And then 5-10 years later, guess what? You're going to be penalized 1% for every month you did not have Part D, the prescription drug plan. That's why I picked Chapter there, because they don't do that. They do the right thing. They say, yes, I understand you don't take prescriptions, but you need it to not get penalized. And let's at least find you one that maybe cost you like $1 a month or something like that. So number one, Laura, you've done everything perfect. Vision and dental, I'm not really big on vision and dental. Usually just, contact your dentist. The dental part of it, get with your dentist you like and say, hey, should I sign up for a dental plan? Or if I pay you cash, can I save money? And usually the dental provider says, oh, if you're going to do a dental plan, pick this one. This is the one I use. Anyway, but yeah, you're doing everything perfect. But your question is, should you wait to collect your Social Security husband account until I'm 70 to get the extra 24%? No, that's incorrect. You waiting till 70 to collect spouse benefits does not give you the delayed retirement credits. Your spouse, him waiting till 70, that gets delayed retirement credits on his record, but only when he passes away. Current spouses do not get those delayed retirement credits. Only surviving spouses get those delayed retirement credits. So number one, you have to in order to get spouse benefits, you have to file for benefits on your own record. And then if you were talking about your current spouse, sounds like we are, your current spouse has to file for benefits. You cannot file for benefits on his record until he actually starts his benefits. And this is what people do. It's called a split strategy. Like the lower earning spouse starts the benefits, starts getting those checks. And when the higher earning spouse starts their benefits, then they take the spouse claim and get those extra benefits. So let's see. Aren't the WEP people now just going to get the same Social Security benefits as the 97%? They won't get more Social Security money than the rest. No, they will. They will get a higher percentage than the rest. What they paid into Social Security is lower because, possibly they worked, for other places, but the percentage they will receive is higher than the rest. So, all right. I am out of time and losing my voice here. So we will call it a day. I'll be back again tomorrow, and hopefully I have my voice back then, and we'll continue.